Good morning. I'm Ann Brill, Dean of the William Allen White School of Journalism and Mass Communications at the University of Kansas, and it is my pleasure to welcome you this morning on behalf of the faculty, staff, and students of the KU School of Journalism and our co-sponsor, the McCormick Foundation. I am especially honored to be here with the veterans and have the opportunity to thank them for their service. We also honor the medical personnel who work to improve the health of us all, and of course, the journalists for their dedication and valor in covering this topic, as well as the wars. You are all heroes. I've often told people that the public is our board of directors and public service through education is our mission. I suspect we all have that in common. Today we are here to learn more about post-traumatic stress. I know it will be an enlightening and valuable workshop. There are few people who should be thanked for making this workshop possible. Clark Bell with the McCormick Foundation. Thank you, Clark. Mark Hamrick for making this venue available, as well as his other help in making this possible. Thank you, Mark. Professor Jackie Spinner for her help in contacting speakers and I guess a lot of moral support. So Jackie. And finally, my colleague, Barbara Barnett, whose idea it was to focus on post-traumatic stress and whose creativity and hard work brought this day together. Thank you, Barbara. And now I think we are ready for our first panel.
Mark is going to say a few words.
Thank you. I'm going to just take a few minutes of time to immediately try to gain your favor. As the immediate National Press Club past president, I learned that one way to gain favor with a group is to make an extremely short speech. So thank you, Dean Brill, and thank you very much for your leadership and the William Allen White School and for helping to bring this program here today. This is a very special opportunity for me to make a brief appearance here in that my own heritage reaches back to the Sunflower State and the University of Kansas. And so as the immediate past president of the club, I couldn't be happier that this event is here today because we truly are at the intersection of two great institutions with rich histories that do very good work. So I'll just say very briefly, Rock Shock Jayhawk. I'd also like to welcome all of you here to Washington, those of you who have traveled, and here to the National Press Club to take part in this special program. You might be aware that the club has a history going back over 100 years. In this building since 1926, when President Coolidge helped to dedicate the cornerstone, it was originally founded as a place to socialize at the Willard Hotel next door, among journalists, I might add. But over the years, its mission evolved, gaining particular traction during the presidency of FDR, who helped usher in a tradition that's very important to the organization today, and that's the luncheon series featuring top newsmakers in the ballroom across the hall. Now, the club's mission has more to do with professional development and a number of other functions today that are related to helping journalists and professional communicators do their job. And professional development and advocating for journalists and press freedoms around the world are very much at the heart of that. So before I step away, I'd like to mention that I'll return here to the club this evening for the reception. And so those of you who are here in person, I'll look forward to seeing you there at that time. And Dean Barnett has been working hard on this workshop over the past year. And so, Barbara, thank you for seeing this through and seeing it through from a vision to the excellent programming that I know unfolds here in the hours ahead. So at this time, I'd like for you all to give a warm National Press Club welcome to Dean Barbara Barnett as I step away. Thank you.
Thank you very much. Thanks, and I'll see you later today. So before we introduce everybody on the panel, what I want to do is just briefly, you have information about the journalist and the program, but maybe if you could just go around the table and tell us who you are and where you're from and nothing else, okay? Just very short, so. And we'll start with Brian.
I'm Brian Dean. I'm from the Oklahoman in Oklahoma City.
Jen Steele from the San Diego Union Tribune.
Linda Dennis with Backpack Journalist.
Meg Jones, Milwaukee Journal-Sentinel.
Patricia Kine with Military Times newspaper.
Amanda Wilcox, the Daily News in Jacksonville, North Carolina.
Lynn Lambert, Baltimore, freelancer, but I write a lot for Psychiatric News.
Martin Coote, Stars and Stripes. Philip Gray, Clarksville Elite Chronicle.
Drew Brooks, Fayetteville Observer.
Randy Brown, the military blog, RedBullRising.com out of Des Moines, Iowa. Lee Hill Kavanaugh from the Kansas City Star.
Jesse Ellison, Newsweek and the Daily Beast.
Brett Whitten, University of Kansas.
Rebecca Ruiz, freelance reporter in Oakland, California. Leigh Navarro, freelance, Toronto.
April Kilcrease, freelancer in Oakland, California.
Muga Jana, University of Kansas.
And Mugar and I are going to co-moderate this panel.
I'm Susan Borgia from the National Institute of Mental Health. My day-to-day job is primarily overseeing a portfolio of grants that go to extramural scientists around the country at universities and hospitals who are studying the effects of traumatic events. So including and primarily PTSD, but also related conditions of suicide and depression, substance abuse, the list goes on and on of the related areas. My background is that I'm a clinical psychologist, so I have a history of treatment and working with veterans and individuals who have been affected by the events they've experienced.
Could I have some PowerPoints, because I want to use them as part of explaining who I am, actually the organization for which I work. My name is Paula Schnur, and I'm the Deputy Executive Director of the VA National Center for PTSD. We were founded in 1989, and our mission is going to be coming up shortly on a PowerPoint, but essentially it is to be all things PTSD to all people. We are supposed to maintain a clearinghouse of information on PTSD and conduct research and education. And there's language in the congressional mandate that we do this for all federal and non-federal entities. So we serve VA, but we leverage that service to provide information that is broader. May I have the next slide, please? That's our mission. Next slide. We do this by collecting centers of excellence. We're a consortium of sites built around strong sites in the VA system. My office and my responsibility is helping coordinate those sites. You may know us, if you know us at all, through our website. It's our major means of communicating, ptsd.va.gov. And there, last year we had almost 2 million visitors to the site. We have a special section for journalists. We have materials for patients, such as understanding PTSD treatment. We have a lot of training materials for clinicians that some journalists actually find useful, PTSD 101. And we're in the business of developing apps. We have we developed with the Department of Defense the first official U.S. government app. There were others before this, but this was the first official one, and it took some very high-level negotiation, I think involving perhaps the White House, to get the contract with Apple. But in any case, all of this information is available there. My research primarily focuses now on treatment and on doing the kind of practical trials that can really drive system change. So less focused on understanding mechanisms or developing treatments, rather focus more toward practical public health applications of care. And I'm going to save my last slide for later on.
Good morning. I'm Mike Kilpatrick. I'm a retired Navy infectious disease physician, now working for the Department of Defense Health Affairs in the Office of Force Health Protection. Our office is very focused on what are the deployment-related health issues and oversee the health assessments done before and after deployments. I have spent probably the last 10, 12 years interacting with veterans, and I think a lot of the lessons learned out of the Gulf War have really set the stage for the programs that we have in place today in the Department of Defense, trying to do early identification of mental health issues, and then obviously access to health care. A lot of this has to do with dealing with non-health issues, things like stigma, and I think also in responding to people's needs to have a name for whatever their illness is. I think if you look back to Gulf War syndrome, that was a term coined by the media, and medically we didn't have a syndrome, but it was a losing battle to try to say it's not a syndrome. And the person to my left here, giving me his chance, really said we need to get past that that if somebody doesn't feel well, then and Gulf War syndrome makes them feel better, then we can get treatment to them. And I think as we deal with post-traumatic stress disorder, post-traumatic stress, or whatever else we want to call it, we sometimes get stuck in this rut of what is it, and often it's never just that by itself. It's a lot of other issues combined. So my work right now is focused on that early identification and how well is the Department of Defense getting people to care. And obviously families are a huge part of that, because the care has to be local and the support system has to be local, and that's in the communities too. So we're reaching out to the federal partners to make sure that from a federal standpoint we're doing our job. DOD, VA, Health and Human Services, Department of Education, multiple others, Department of Labor. They all have a piece of this, and so I look forward to today and to the questions.
Hi, I'm Chuck Engel. I am the director of a center called the Deployment Health Clinical Center. As was Dr. Kilpatrick just alluded to, it started out in the middle 90s in a place called the Gulf War Health Center, and we've been really working ever since at our center to improve the services that are delivered for folks that return from deployment. I am a health services researcher and a public health scientist and a psychiatrist by clinical training, and have sort of come through to PTSD through a route, and through a broader route of how do we improve mental health services to populations. And we really have two major challenges, I would say, from trying to deliver services to those in need. And one is something that we know a lot about, and that is improving the quality and effectiveness of the services that we have available to those who are in care. But one that people know quite a bit less about is, and from a population perspective, is very, very important, and that is how do we serve the about 75% of folks with post-traumatic stress disorder who are not receiving care at all for their problems. Much has been written and said about the stigma associated with this, both in and out of the military. We have been running for going on 6 years now, a very large program called Respect Mill that is in the primary care service system in the military, where we're actively reaching out and giving service members a chance to raise their hand and say that they need services in ways that they might not be prone to recognize or acknowledge if they're not asked in this way, and then to develop a system around that to assist the primary care doctor in getting the patient to the services that they prefer and are most indicated for them. So it's a pleasure to be here.
Thank you. My name is James Munt. I'm a senior research scientist for Center for Psychological Consultation in Madison, Wisconsin. Also an adjunct appointment at University of Arkansas for Medical Sciences, and also have a consulting company in Cashel Technologies. My history is primarily, my training is as an experimental psychologist at Madison, and primarily in human factors engineering psychology, and became involved in and have been engaged for the last 15, 20 years in electronic assessments and monitoring of what would actually be more comorbid situations to PTSD. My background is primarily more in assessing alcohol abuse, depression, and suicidal ideation most recently, particularly as they relate to within clinical trials, and not so much in PTSD. So I've spent the last 3 weeks reading up everything I can on PTSD, and have been really struck by what the overlap is across in the clusters and the comorbidity and the milieu of everything that mixes together. The majority of the research that I have been involved in, currently involved in, have been funded by National Institutes of Mental Health, National Institutes of Aging, in which we're developing internet-based and electronic-based training of therapists to provide cognitive behavioral therapy so that they can provide those most efficiently, and now building in the processes whereby we can use technology to facilitate the homework and be able to monitor the things that are going on between the sessions. We also do structured clinical interviews for assessment for diagnoses based on case ads, PrimeMD, and some of the structured interviews that are being used here. We also do automated telephone systems looking at cognitive impairment, primarily in Alzheimer's disease that we're doing, but we relate to TBI. And most recently, some of the things that we're looking at sort of on the leading edge is doing analysis of vocal acoustics and speech as an indicator of CNS dysfunction that may relate to changes over time related to depression and response to treatment.